Miigwech Renee,
Thank you.
would you please introduce yourself?
Sure,
I'm
Dr.
Renee,
Rabbit. Oh,
me.
Yes, please, Renee.
Okay, I'm Renee Bolio Banks. I work at NACC a little over 2 years, and I'm from Leech Lake. I live in Minneapolis, and it's great to be here. Miigwech.
Miigwech, thank you. And then Dr. Gail Mason, would you please introduce yourself?
Hi, I'm Dr. Gail Mason. I'm the clinical director here at NACC for behavioral health.
Thank you, Miigwech. And Tina?
Hi, I'm Tina. I'm the non-medical HIV case manager, and I help coordinate the ECHO.
And then for our guest, Mo Mike, would you introduce yourself, please?
hello, I'm Mo Mike. I work with Indigenous Peoples Task Force, and I sit on the board of Southside Harm Reduction. I'm also a part of a few steering committees, I guess I'd call them, National Native HIV Network, as well as the ending the HIV epidemic in Indian country. We are indigenizing the strategy that United States has come up with so that we can use it in our communities.
Miigwech, thank you. Thank you for being here. My name is Kari Rabi. I'm the medical officer and a family practice and addiction medicine physician here at the Native American Community Clinic. So thank you all for joining us today. Next slide, please. So we always go through our agenda first. So we've already had our prayer and land acknowledgement. I'm doing the introductions and agenda. I'm going to do Zoom guidelines. Tina is going to do our announcements for us. Mo Mike is joining us for our didactic. We're not going to do a case presentation today, and then we will close. So I think we all know how to use Zoom now. However, just to go through it quickly, please introduce yourself in the chat function so we know who you are, your name, title, organization, and email. You can update your name on the screen by right-clicking. And then if you could, next slide, please. And then if you could please turn your if you could please turn your camera on if possible, so we can see you. It's just easier for us to have a conversation. You can mute your microphone when you're not speaking. You can use the chat and hand raise function for attention, and then please no protected health information. Next slide. I'm going to turn it over to Tina.
So announcements, just a reminder that this ECHO meets every first and third Wednesday of the month from noon until 1 p.m. And upcoming ECHO sessions. So the next one will be Wednesday, November 3rd. And Kim Price from NACC will be talking about CPS and mandated reporting. And I believe she'll be talking about that alongside Dr. Rabi. And then beyond our next ECHO session, we don't yet have anything planned, but we have some things pending. And if there's anyone in the audience who feels inclined to put together a presentation, please let me know. Other ECHOs, kind of related, on the first and third Tuesdays of each month, there's the viral hepatitis ECHO, and then every Thursday, there's the integrated opioid and addiction care ECHO. And these are kind of under the auspices of Hennepin Healthcare. So if you would like to attend those, or you want more information, you can go to the website for the ECHO on Hennepin Healthcare, or you can email Beth Ryan. Case presentations, we are not doing one today. Usually we like to have one as a way to learn from each other and learn together by talking about actual difficult cases. Anyone is welcome and encouraged to submit a case presentation if there's something that they want to talk about among the group. If you want to bring a case presentation to the table, please reach out to me directly This is my email address, or you can just reach out to me in the chat. And then as far as continuing education, so this session does offer continuing education credits. If you would like to receive those credits, you will need to complete the survey that I email out at the end of this session. So just a reminder to please, in the chat, just tell me who you are, first and last name, your email address, your organization, and I will make sure that you get added to that email list for the satisfaction survey. And if you do put your info in the chat, it's helpful for me, just because we like to know who's coming. And then just the disclosure, all planning committee members for this educational event have reported no relevant financial relationships with commercial interests. And at this point, I'm going to turn it over to Mo.
All right. Well, I'm not going to take real ownership of this, that harm reduction is traditional, that it was my idea, because it was actually an idea that had come. I went to an HIV presentation up in Canada during a conference, and the person was Sharp Doppler, who had talked about this. And as they were talking about it, I was like, oh, I do that. Oh, I do that. Oh, and I realized that a lot of what they were talking about was basically, how do we treat people in the field when we're doing outreach work, or even like within closed doors, you know? And, you know, that really stuck with me, because we have people out there that are living unsheltered and are also often people who use drugs, either injecting, smoking, snorting, and there's a lot of stigma associated with that. And when I think about harm reduction is traditional, and thinking about the teachings, the grandfather teachings of the Anishinaabe is what I use for this basis, because we're here in Minnesota. And I just took the ones from Eddie Benton Benet, because you know, I always heard his name in passing throughout my years here in Minneapolis. I'm a Cree, I'm a Nahia from Central Saskatchewan, Canada, Beardies and Okamesis Cree Nation. And so I'm a visitor here. And so I wanted to use what was beneficial, what I learned from being here as a part of this. And so can we go to the next slide, Tina? All right, so we all know what values are. And basically I wanted to put this out there so we could really take a look at our own values. You know, what do we value most? They help us determine what's important to us. So, you know, like me, I value having fun every first Friday night. So I make sure that I always save a little money so I can go out and do what I like to partake in, you know. And each of us have different values. Some of us value family, some of us value travel, some of us value how we live our life. And that's really what I want to talk about, is how we live our life. And you know, what values describe personal qualities we choose to embody and guide our actions, you know, like the 7 values of the Anishinaabe that I've come to learn, and they coexist with one another. If you use one, you're probably going to use 3 or 4 of the other ones, because they all work together. You know, like when you start working on one value in your life, all of a sudden you're going to notice that other values in your life are starting to align with those values as well. And so there's less room for people who start to use these values on a daily basis in their own lives to really stigmatize people or put them down or treat them in a way that they are less than, because you know what, none of us are less than. We're all people. We are all trying to live on this earth together, and a lot of the people that are out there had come across issues that they couldn't overcome, and their coping skills, maybe they didn't learn how coping skills growing up, and this is what they learned as they were growing, as they found something that could help them to cope with the way that their life was, and then it became something that was too big for them to handle anymore. And so these are some of the things that I think about when I'm out there with the people that are coming to us for services, or that we are going to offer services to when we do outreach. Can we go to the next slide, Tina? Okay, so these are the 7 grandfather teachings, as I've read about and learned about, and especially from being in this community in Minneapolis. Humility, bravery, honesty, wisdom, truth, respect, love. And I wish I could say the Anishinaabe words for them, but I'm not going to butcher a language that I don't really know very well. And but however, when you think about these in terms of each of them on its own, when you think about humility, you're not going there to people and like, being all pompous and like I'm the best. I'm the one that you need to help you to get through things. No, that's not humility at all. Humility is going and like maybe asking them, like, do you need any help? Like, is there anything that I can offer you? And maybe they might say yeah or no, but like accepting their answer as is and not trying to, make a way for us to get into their lives if they don't want us there. Bravery is being able to just stand up and say the truth, like, and being able to talk with people that are out there and not having no shame about that. And being brave is also like helping them when they need it, and like coming against forces that like the police, like standing up and being an advocate for them to the police or to the medical community. And I really appreciate NACC, because I think that you really have a harm reduction approach to life for the people here, and I really appreciate that. Honesty, you can be honest with people. I had a few people actually that have come through my Syringe Exchange course, and they came straight from the hospital, and they were being treated for endocarditis, and they ran away because they weren't also being treated for their substance use. And so they were getting sick in the hospital, and so they come to get needles so they could inject, so they weren't sick in the hospital, because they weren't, their addiction wasn't being treated, only their endocarditis. And so like that's so wrong, I think, especially when they're in a place where that can be really taken care of properly. And I've told them the truth, like, you know what, if you don't go back to the hospital, that's going to interfere with the way that the medication helps you, because if you don't use the antibiotics properly, then your whatever is being treated might not respond to that anymore. And so you're going to have to find something else, and it's going to just keep you in the hospital longer. And so those two people, because I was able to talk with them and share the honest truth that they could die if they continued to stay out of the hospital and not go back and get treated, that they did go back, and I'm really thankful that they really listened to what I had to say about that. Using wisdom, sometimes people like come across people who are angry and then start getting angry at them too. That's not wisdom. You know, wisdom is taking a look at the situation and, okay, seeing how can I help de-escalate this? How can I change it so that they are feeling heard or feeling supported? Because maybe they might be angry at something that's totally justifiable. Maybe it's not something justifiable, but something where we can at least give them an ear, give them something that where we're being the person that can help them to calm down and really look at their situation in a better way. You know, respect, you know, go up with people with respect, you know, like there's a lot of people out there that sign, you know, instead of just looking away, give them a smile, you know, give them a wave. If you don't got no money, like, you know, do this, like, I don't got no money, but I'll give you a smile, I'll give you a wave. And they appreciate that. I know, because I do it. And, you know, like, you don't have to give them anything but your smile, and they appreciate it. You know, that's how us humans are, except for the really super grouchy ones. And I don't know how to deal with those. You know, love is just treating people as if we want to be treated. Love is just showing them, like, you know, if you have an extra sandwich and you're walking down the street and you see someone and, you know, they're like, hey, can you give me some money for some food? Well, I don't got money, but I got the sandwich. You want it? You know, like just easy things like that. I think about all the people here that have family that have cut off their loved ones who are out there in the streets because they may have stolen from them. They may have, like, you know, used up all their options and they just like tired of it. But, you know, our people need love. They need someone who supports them regardless of what their choices are. I know that if I didn't get that love, I wouldn't be here today. I got that love. I got that love from people who I didn't even know, you know, and it made a difference in my life. You know how many times I get told, Mo, you know, I'm so happy to see you. You know, I've been 3 months clean now. And, you know, if you didn't talk to me, I wouldn't be here. And then there's others where, you know, you give them a hug and then they OD the next day because they're so hurting that they used, and it happened to have fentanyl in it that was too much for their system, and they weren't in a place where they could get Narcan, or someone had it, or they were alone, you know, all of those things. And so, like, when I think about the work that I do and others like me, using all of these grandfather teachings with the unsheltered and with the people who use drugs, or even just regular everyday people in your life, you know, they remember that. I remember it when people treat me good. And I'm really thankful for those people in my life, because sometimes people don't have very many people of those types in their life. And so, like, us being out there and being there for them in ways that we can be is important. Next slide. Thank you. So yeah, you know, we all understand our relationship to creation. Well, we might not all understand it, but it's innate within ourselves. You know, like when we put our feet on the ground, we could feel the energy from Mother Earth without our shoes on, you know, and dig our feet into the soil. That feels so good. I remember when I was a kid, I used to go outside and really early in the mornings because we had to be awake early. And I was always the first one in my house awake. So sometimes I'd go outside in the sun and feel the dew on my toes, just because it felt so good on the grass, you know. And those kinds of things are like something that we need. Even like people talk about, like, they want to get sober, but they don't want to do this, they don't want to do that. And like, but when we open up their eyes to like what's the possibilities, they start to see that maybe it is possible to get out of the situation that I'm in and make a change in my life so that I don't be unsheltered. So I'm not continually chasing to feed this monkey on my back. You know, there's other options like Suboxone, like methadone, like, you know, harm reduction things. So maybe using less times. All of these things like are helpful to our people that are out there to give them some kind of space. And like, that's the other thing. Like, I wish that we had a space where unsheltered could just go sit and relax and have a coffee and not be stigmatized and not be told, oh, you got to move on. Oh, you can't use the bathroom because we're scared you're going to OD in there. You know, all of these things are like detrimental to the people that we serve, you know, and so they don't have a lot of trust for the general population because they get mistreated. They don't be allowed to use a bathroom. You know, they're unsheltered, but they can't use a bathroom anywhere. Like, that is a cruel and unusual punishment, I think. Not a place to wash your hands. All of these things are like something that I think about when I think about the people out there. You can go on. Next one, please. Bravery. And then again, like, you know, like I said before, like, we could talk to things and we might not like the consequences of being brave, you know, having to stand up to cops when they're trying to be assholes to our participants and then, or other people, in fact, you know, and it's like, why? You know, like, what made you the judge of this person? You know, you don't know where they've been. You don't know what they've been through. You know, when I speak from my own experience, I experienced all levels of abuse. I experienced spiritual, sexual, physical, mental, emotional, and I'm here. But I'm here because people cared about me enough to like love me up when I decided that I was ready, you know? And had I not had that, I wouldn't be here today. I know it. And so I think about that when I think every single person that comes through my door. I think that could be me. That could be me. Because I don't know what they've been through, but I do know what I've been through. And even if they only had a piece of that in their life, that could have been me. And so I think about that. I lost my parents. I lost my mom and my dad. I lost 25 people in the past 6 weeks from my life back home. 25 people, you know, and none of them was COVID deaths. They were all different, like age, accidents, you know, their health because of like diabetes and that kind of stuff. And, you know, it's hard for me to deal with. Well, think about the people that are don't know coping skills. You know, how do we help them? By loving them, by showing bravery and, you know, speaking our truth to them. Next one. Honesty. Well, it takes bravery. So see, like I said before, they work together. It takes bravery to be honest in our words and our actions. And people who see how we live, how we treat one another, how we treat the people that are out there. People notice, you know, especially the people out there in the streets. They notice us, either if we acknowledge them or not. They notice, you know, who's gonna give them, you know, a little bit of love. Like, you know, sometimes I get asked for things that I don't have, and I can be honest and say, you know what, I don't have that, but I think I can find it for you. And, you know, being honest also means following through, you know. So if you say, I think I can get this for you, you either have to follow through and get it for them, or I'll say, you know what, I tried and I couldn't get it. Just be honest. And you know what, they'll take honesty more than they'll take, oh yeah, false promises. You know, you break your promise with them and then they don't call you up anymore. They don't they don't try to seek you out to give them some help because they think, well, they broke this promise, then they might break this one too. So they're just not even gonna bother, it takes a lot for us to be honest, even to ourselves, like I had to be honest with myself about a lot of things that I didn't like about myself, but that was because I wanted to change them. And so like, if they want to change, we got to be honest with them too. And they got to claim some of that honesty, but continue. I know I only have a certain amount of time. So when we talk about wisdom, that's like pulling together all of these values together and using them. So wisdom isn't going up to a person who you see injecting on the ground and say, hey, you shouldn't be doing that here, because you know what, maybe they're alone and they want to be seen in case they overdose. Have you ever thought of that? And just because, and would you rather them be hidden somewhere? And maybe your kid likes to go climbing around those hidden places and they find a person who has passed away right there in their hidden space. That's a hard thing to see. I've seen a few people who have passed, and that's a hard thing to see. That's a hard thing to even watch happen. And so like, I understand when people say, oh, we don't want to see it. But at the same time, if you don't want to see it, then you really don't want to help that person. You really don't want to also see the person as who they are. They're a person struggling with a lot of other issues that are beyond just addiction. There could be mental health issues. And so when we use wisdom, we approach people in a gentle way. We're not approaching them in an angry way. We're not approaching them with all those other negative stuff. Like, what's your intent when you come across a person? Is your intent to use them? Because there's a lot of people out there that are predators that will draw a person in, and then next thing they're using them. We have several instances of that happening in our community, and we all know who those people are. And I'm not going to talk about them because that's not right. But, like I also was a part of these meetings in the beginning. I don't know what they're like now, but these meetings in our community, and they're coming up with all these solutions for the people, but they're not even acknowledging that these people should be a part of the meetings as well. One of my colleagues had went and said, well, why don't they get a seat at the table? And then they were just shut down and said, no, they're not allowed to come here and be a part of this. And it's like, but that's who you are wanting to help, but you want to use your own ideas rather than what they really want or need. Like, that's really parental, and that's really like taking their autonomy away from them when you do that. And so like I just didn't want to go to those meetings anymore, because especially in the beginning, where I felt like I was the only one that really embraced harm reduction, because I heard words like increased criminality in our community, prostitution. I heard those words in those meetings, and I'm like, you're taking the humanness away from these people by talking about them in such a way that it's negative connotation, and I really, really, that hurts me, because you don't know how they ended up there. Do they have anybody that's ever going to support them as far as getting clean and sober, especially if all their family freaking disowned them because of their use and how that use affected their lives? And so for me, that's like a big issue. And so I just do what I do when I can, and continue to be who I am in the community, which, is pretty easy, because I really try to embody all of these in my daily life, because it's so much easier than, you know, all the other ways of being that are negative, you know, greedy, you know, and using others. And like some of those are the things that happen when people are using, but it's not because they're really greedy or because of this, but it's because they have a monkey in their back and they got to keep feeding that monkey, otherwise they're going to be sick. And so they still want to have lives, they still want to look good, they still want to like be a part of the community. It's just that they have this way that they don't know how to let go of. And we can only help them if we start sharing with them through these values. You know, there's some people that say tough love is the only way to work. Well, yeah, if you use tough love, make sure to use tough love with these values still as a part of it, you know, because being truthful and saying, you know, if you go down this road, continue down this road, you're going to die. Or, you know, like nobody's ever going to support you. Like you could talk like that to them, but it pushes people away. It really does. I got pushed away a lot by a lot of people back when I was very first using, when I was very first like doing a lot of different things that I just wanted to try. Can we go to the next one? Truth. And, you know, I talked about this already, and like all of these is all work together again. And so when leaving out even one of these teachings means that one is not embracing the teachings. You know, I hear people saying, oh, I'm level 1 Made, oh, I'm level 8 Made. Oh, I go to sweats and I like, I'm there to pray for the people. But then these same people look down on the people that we are serving and make judgments, use stigma. If you're doing any of these things, there's no room for stigma. There's no room for judgments. There's no room for you to be in that space. And so like when I hear people saying that they're doing that, but then that they're following these, you know, their traditional ways, but then they're keeping people out, that tells me that it's more like a religion than a spirituality that they're following. You know, that's the way I feel. Because when you're really spiritual, like following Creator's guide, you change. The way that you live your life changes, you know, and I acknowledge that, you know, like I'm not perfect. I like to gamble. I like to have a drink once in a while. I use medical marijuana. And I see a therapist. And like I like to go to shows that are basically sex workers, you know. And but the sex workers that I see, they choose that. They're like, they make their own choice. They're up on a stage. They're not in the street with a person that's coercing them towards that. Or else, even if they are on the street, like I'm not using those services because those are the people that that I want to be of service to. Why would I ever do that? You know, so like those are different things. Or why would I sell drugs to them when I'm trying to help them? Like, and there's people that have done that in our communities that say they're helping, but then they go out and do that. Even people I didn't ever expect, then I would hear their name come up and I'm like, what, for real? And like, and see the evidence that in fact that they are doing this. And it saddens me, you know, like, because there's some people that I really admired, and to know that they're in this space with the people. Next one. Respect. You know, when we start showing respect to the people that are out there, they start to show respect for us, and they really like it when they see us, you know. And I do know that because I see it when I see other agencies out in the field, and then how many people clamor towards them, not only because of the services they offer, because they want to talk to them. They want to say hi. They want to, like, you know, chill with you for a minute or two. And like one of the things I can say about respect is, so I used to work at the Navigation Center back in the day, and I was there to make sure that people were safe, and then, but I was always respectful to everybody. And I would leave my phone. I'd leave my phone when I would leave my desk to go and do some other thing, like maybe somebody wanted some cereal, or I needed to bring someone to the, let someone in the shower. And I would leave my phone there. Invariably, someone from my tent would come out, one of the guests would come out, and they would find me with my phone and say, you can't leave this here. That's how much respect I had with the people that was using in that tent. And they all had that respect for me. I never lost my phone once, and I left it there multiple times, you know. And to me, that shows me that they also had respect for me, because I respected them and their economy and the way that they live, they chose to live their life. That's not my place to say, you should all change your life. No. Do you want to change your life? Here's some of the ways that I can help you. I can, you know, my good friend over here, Jenny, knows how to get people into housing. Oh, my friend over there, he does Rule 25s, and he said I can call him up anytime and he'll get you in as quickly as he can. Like, those are the kinds of things that we can help them with when they're ready, when they choose it. You know, you can always talk with people and say, you know, are you ready to leave this? You know, how's it going with being out here, you know? And you find out what they really want and need. And, you know, like I was told about the women's camp that is at the old SA, the old Speedway that's over on 25th and Bloomington. And the women there feel safe and call it home. They feel safe and call it home, even though it's outside, because they're in an enclosed space. It's a women's space. And so men are not really allowed inside. You know, men are outside to protect them, but not inside, you know, and I really appreciate that. Can we move on to the harm reduction part, I think? Oh, love. I already talked about this. You know, when we love one another and show love, people respond to that and really appreciate it. And I know, because I have a lot of that in my life just from being here and doing the work that I do. And even in my own personal life, I have a lot of people that I love and respect me in the same way. And when we give it freely, it comes back to us. And I really, truly believe that, because it happens in my life daily, you know. And, you know, I love to see people that come through and then they tell me a story about themselves that that they just wanted to share with me because they knew I would listen, you know. And so I'm really thankful for that. Next slide. I think this is all about harm reduction now. I already talked about this, you know, like it's basically you have to use all of the teachings together. So wisdom, love, respect, bravery, honesty, humility, and truth. When we use all those together, there's absolutely no room for stigma. There's absolutely no room for judgment. You know, there's absolutely no room to mistreat a person. And that's really the importantest part of our work, which is the next slide of harm reduction. Is it yet? Oh no, next one. I think I did this. I think this one's a twice one, that's why. So like so these are the principles of harm reduction that is on the Harm Reduction Coalition website. And there's 8 of them, but basically, you know, when we accept that people use drugs and choose to use them, well, what we can do is help to minimize their harmful effects. That's why we have syringe exchange. That's why we have condoms. That's why we have Suboxone. you know, so that at least that there was the methadone, other ways to help them. Maybe you know, treatment once a week, or even like someplace where they could go and talk about things with someone, you know, those like, and just accepting where they're at, you know, instead of trying to change it, and like, unless they want to change it. That's autonomy. That's allowing people to be who they are and be humans. And we also have to understand that drug use is complex and it's a multifaceted issue, you know, and that's because there's so many things, like maybe their main coping mechanism, and maybe that they can't cope without it because they never learned how to cope with things without, because they never were taught that growing up. I wasn't taught that growing up. I had to learn it as an adult, how to cope without using stuff. When I was a kid, I used to use school, and then once I was out of school, then I used alcohol, and you know, and then any hardship that came by, I was drunk, you know. And so like, when I started to decide that I wanted more out of life than that, and I changed it, I went to therapy, I went to groups, I did all kinds of things just so I could get Mo back to Mo and being who I am today. And so like any amount of harm reduction that we can do for them, or help them to do, is beneficial to their life, regardless if people in the community see that or not. Because people just see syringes out in the community and think, oh my God, that's just the worst thing ever. And but at the same time, on the other scope of it, like maybe those people just stopped caring because nobody cared about them. So they're like, screw this. Like, or the other thing is that people get stopped with syringes, they get a felony for what's inside the syringe. And so that's why a lot of people throw it out without ever carrying it around or keeping it close to them to bring it to a syringe exchange. Not because they don't want to keep it, but because they don't want to end up in prison or in jail, or, you know, because if you end up in jail or prison, then you might have to be sick for how many days, you know. And I was in the hospital last year, and then I was taking some opiate, and then I had stopped. I got like that sick. I got sick from that. And so when I think about how sick I got, and I think about the people that have been doing it for years, I'm like, oh my God, like I can't imagine what their withdrawals are like. Services and resources for drug users should be non-judgmental and non-coercive. You know, this is where we use all of those values that I talked about. And you know, the successful interventions, when we use the 7 values, we help to create a quality of life for them that is better, because, you know, they're being loved, they're being cared for. They're thinking, maybe I can make a change, you know? And so we as providers, if we go through this, and especially like our front desk folks, the first people that see the people that are coming in, those ones should really be people who follow some type of values like this, because they're not going to be short with people. They're going to talk to them in a way that is not judgmental and stigmatizing. You know, I keep bringing those up because those are the 2 biggest things that happen with our people out there that are unsheltered, that are use drugs, that have a difficulty to even get a step up, because a lot of the step up is, oh, get into a shelter. And then a lot of the shelter beds are like it's so packed like sardines in there, or there's people that they don't like in there, or maybe someone had been like violent towards them in the past and they're in there. there's all kinds of different reasons why they don't like to be in shelters. And so they'd rather be outside because at least they get to be autonomous and do what they want to do. Next one. So those are 4. These are the last 4. So I said before, drug users should have a voice in the creation of programs and policies designed to serve them. Well, with this meeting that I was talking about, and they're not allowed to be part of that creation of programs and policies that are aimed at them, then what's the point of having this whole thing when if you have people in there that have no idea how drug users live their lives outside in the streets and what calamities that they approach every day that we don't even see. You know, how are we supposed to help them when we don't even know the extent of what they are going through? You know, they are the primary agents of reducing harms. Drug users are, for real. You know, like how many people I know that are drug users that have saved multiple lives. You know, they are out there saving each other's lives every single day. It's not us that are sitting in our offices. It's their peers that are right there next to them. And, you know, that's why when us as harm reductionists talk about having a safe consumption site, this is why, because we want to be able to serve people in a safe way where they're going to be able to still use and still be able to, you know, because they're going to use anyways, regardless if we give them a safe place or not, they're going to use. And so I figure it's a way better thing to give them a safe space where they can, you know, at some point get maybe other services, maybe stop using altogether, maybe like, you know, get housing, maybe find the right fit for them if we had a safe consumption site. And they have like a successful one in Canada called Insight. It served over 500,000 people, 500,000 like instances where people have used it and they haven't had one death. Like that's freaking unreal. That's the best kind of information about safe consumption sites that people don't want to see. They didn't lose a life. You know how many lives we've lost in the last month for overdose? I don't know, but I know people out there that could tell me. I know that we lost one last week that was only 24 years old, you know, and she didn't have to die. You know, maybe she could have had somebody to talk to if we had a safe consumption site for her to come in and use and then say, you know, like, I really don't like using all the time, but I got into it and now I can't stop. You know, like there's all these different things. And, you know, we also have to recognize that all of these things, poverty, class, racism, social isolation, everything, social iniquities affect people's capacity to effectively deal with drug-related harms. If you're thinking that you're going to be assaulted while you're out there or anything, and that's biggest in your mind, you're not going to think about housing. You know, you're not going to think about your health. Oh, I have HIV, but like, you know, I'm more concerned about the fact that I have a place to sleep than to take my meds, you know, because it's not affecting me in the moment right now, you know. It will in the future if they don't get any services like that. But at the same time, like I know success stories out there that Sarah Jane has shared where people are undetectable because they chose that their life is important enough, even though they're still using, that they are going to take care of their health in that way. And their HIV is undetectable, which means that they're not going to pass it on to someone else, even if they say are syringed or have sex with that person. You know, it's still recommended to not share needles. It's still recommended not to have unprotected sex with people who inject drugs. but it's still a very important piece. And, you know, people could be rich and they could still get, be addicted to drugs, you know, and have problems that branch out from their lives. And, you know, the other thing is that we don't minimize what they're going through, you know, we accept the reality of where they're at and what they're doing. And like, you know, offer as many options as possible for change for them. And they can choose to take it whenever they want to or not want to. You know, like when I finally decided that I wanted to be in recovery, I chose that. And I chose to live in a place where Monday to Thursday, my curfew was 9 p.m. On the weekends, it was 11. And on Friday and Saturday, it was 11. And on Sunday, it was 5. But I chose that because I knew that I wanted recovery more than this not being able to live my life fully without no constraints. It was better for me to do that. And if I didn't have people who shared with me any of these values, I never would be where I'm at today. And I'm really thankful for those people in my life. And I really like hope that you think about these, you know, like in your own life, which is the next slide before it's 2 minutes to 12. So these are the questions that I want you to think about when you are doing your work, or when you're at home, or when you're with your friends, or when you're out in the community in different ways. Like, how do they show you? How do these values show yourself in everyday life? If these don't show themselves in your everyday life, okay, do you really, you know, like, are you really doing everything that you can to be a good worker for the people? How do these values show up in my harm reduction work? You know, if these values aren't even showing up in your harm reduction work, are you really a harm reduction worker? You know, or how about other movements? Like, how do they show up? How do you value a person who may not be where you want them to be, but be where they're at? And, you know, like, these are these questions that I want you to think about for your own self. They're not, you know, they're not about me, they're about you and how you want to approach your work in the community. Because you know what? Every single person that we work with is important, because they're important to somebody. Even if they've been cut off from their family's still gonna miss them if they die. And for me, that is why I do this work, you know, because I care about people. I love people. I don't want them to die. I want them to be not on the street, but I also don't want them to make that choice for them. You know, just like nobody made that choice for me. I made it for myself. But I had a lot of support doing that as well by people like you. Thank you.
Miigwechmo, that was really amazing, aspirational, and grounding at the same time. Thank you for that. We are going to officially wrap up, but I know if people want to stay for like 5 to 10 minutes, we can certainly take some time to have some discussion. Anybody have any questions or comments for Mo?
Looks like we're all ready to leave.
No, I just wanted to say, Mo, thank you. You know, we've worked together in the past, and you know, great job on being honest and telling people how it is. You know, not everybody would come out and say things the way you did. You did a great job.
Thank you.
I totally
Definitely
agree.
think that you put it in a perspective of why we have the harm reduction in the first place. So I really appreciate it.
Thank you.
it really took us back to basics of why we're doing what we're doing and how is the best way to do it. And it was really great for me and good timing for me as well.
Thank you. I appreciate you all and the work that you do. I really do.
Miigwech, we'll call it, and hopefully we'll see you all again at our next session, which is, what's the date, Tina? November
3rd, and it's going to be Kim Price, RN, and Dr. Robbie talking about CPS and mandated reporting.
Thank you.
Thank you all.
And Miigwech, thank you again.
Thank you.